Provincial and territorial governments across Canada face the common challenge of improving the quality and accessibility of healthcare, but in a period characterized by slower economic growth, an aging population, growing chronic disease burden, and the proliferation of expensive new technologies. David Dodge, who you know as the former governor of the Bank of Canada, but he was also a former federal deputy minister of health, provided an excellent, albeit very worrisome, diagnosis and prognosis a couple of years ago in a C.D. Howe Institute paper he titled Chronic Healthcare Spending Disease. Mr. Dodge and his co-author Robert Dion called for a quote-unquote adult conversation about these challenges and the potential solutions. The Dodge-Dion study tracked the rise of total healthcare spending as a share of GDP since 1975. It increased from 7% to 12% of the national income, a rise of 70%, with real healthcare spending doubling between 1975 and 2011. And in 2014, Canada spent $215 billion on healthcare, standing at 10% of our GDP, the fifth highest among OECD countries. And just for some context, that's about the same share of GDP represented by Canada's manufacturing sector, and significantly larger than that of the mining, oil, and gas industry. The author's projection is for health spending to actually continue to rise to nearly 19% of GDP by 2031. So even in the best case scenario, which they describe as very optimistic, the ratio will exceed 15% of GDP. But now think of where we're at in terms of our provincial and territorial budgets. They are already devoting upwards of 40% of their budgets to healthcare. So there's very little room to increase healthcare funding without compromising other important public services. We are now currently transferring $40 billion annually to the provinces for healthcare. It's the highest funding in the history of Canada. And we have, you should know, more physicians working in Canada than we have ever before. And yet, we still face these chronic problems in healthcare. So we know that more money is not the solution. Our challenge now is simply to get more innovative and make better use of our existing resources to achieve an efficient, more responsive, and financially sustainable healthcare system for the long term.